and welcome to our School Compassionate Culture Analytical Tool for Educators simulation about addressing trauma, equity, and justice. We're really pleased that you joined us today. Today, you'll be talking with Dr. Christine Mason, who's the Executive Director of the Center for Educational Improvement, myself, Dana Asby, the Director of Innovation and Research Support at CEI, and Dr. Michelle Rivers-Murphy, the Associate Director of Heart-Centered Learning for CEI. We're really glad that you joined us today, and we're excited to teach you a little bit more about our tool, the S-CCATE, because S-CCATE helps educators in this very uncertain time vision and plan for implementation of compassionate and trauma-informed practices.
So when we think about the trauma that children normally experience, we know that exposure to childhood trauma can lead to heightened fear, anxiety, depression, and difficulty regulating behaviors, inattention, and difficulty with learning. However, in this time of COVID and unrest and people globally striving for racial justice and equity, what we have is a magnified emphasis on trauma and also perhaps a unique time where we might be able to find solutions that wouldn't arise during our day-to-day, everyday school and work environment during times that aren't as full of crises. So some of the things we know that are important to consider right now. How can we help students and their families and teachers feel a sense of calmness? We know that many students miss the connection, and so relationships need to take priority. Sometimes students are asking questions about why, and we know that we want to come up with developmentally appropriate answers. And for teens, a lot of times that means giving them factual information in ways that they can understand. Staff want to know what to expect. We know that if we take some time, if we're thoughtful, mindful of what we can do, we can help to reframe behaviors. We're concerned about physical and emotional safety. Peers support each other in many ways, and with the distance and distancing, it's harder now, but peer support can be amplified. There are ways to do it even virtually. And as you do that, and as you pay attention to what the students need, you can build trust. And with that, you give students more voice and choice, and you empower them to make more decisions about their learning. We want to do this with an eye towards being responsive to cultural needs and in a climate where there's collaboration.
And as we go back to school this fall, one consideration is that staff understand the neuroscience of trauma to help them be able to respond to those disruptive behaviors that are a result of trauma in a more compassionate way. So one way that we like to talk about that is relating the impact of trauma to the central nervous system and how mindfulness can help with that. So we know that trauma is something that happens that is too much, too fast, or too soon for the body to handle it. And that does have many effects on the central nervous system, including a smaller prefrontal cortex, which really affects executive functioning, those skills that are very important for learning, including decision-making, prioritizing, and organizing thoughts. And all of these are based off of research studies. Another way that the central nervous system is affected by trauma is that it results in an overstimulated amygdala. That means that these children, their fight, flight, or freeze response is on a hair trigger. Something might not actually be dangerous, but they might perceive it that way, and their response might look like an overreaction. Another way that trauma affects the central nervous system is an underactive hippocampus. And this does make it difficult for students' learning, especially related to memory. Another effect is a disruption in the vagus nerve. And the vagus nerve is a really central part of the nervous system that goes from the back of the brainstem and wraps around all of the major organs, touching the lungs, the heart, going all the way down into the gut. And it works to regulate the entire system. And trauma really makes that process hard. Luckily, however, research shows us that yoga, breath work, and meditation also have an effect on the central nervous system. In fact, studies show that those who practice this regularly have increased executive functioning skills. And that increase is even larger for students who had lower levels of executive functioning at the beginning of a program. Another effect of mindfulness practices is to regulate that amygdala, to help adults and children calm down that response of wanting to respond to what they might perceive as danger by running away or getting aggressive or freezing in place. Another way that mindfulness helps is that it helps to support a functional hippocampus with greater memory. And lastly, it has been shown to regulate the vagus nerve. So why is teaching the neuroscience of trauma so important? Well, we know that the stress response system not only affects mental well-being, it also affects physical health as well. So teaching these students about this process can actually be life-saving in the end.
So Dana just spoke about the neuroscience and how mindfulness, which we remember, mindfulness is being present in the moment without judgment, how mindfulness can help. And I just want to point out before we move on that when we think about mindfulness, yoga, meditation, breath work are there, but also it is that sense of awareness about what's going on. So mindful of yourself and how you're feeling, mindful of the students and their needs. So next slide. Okay. So we also know that during this time that we're seeing great disparities in access, education, and equity. And in fact, many students and family have faced long-term repercussions of trauma and discrimination. Racism and implicit bias have lasted far too long in this country. We see among students who are disenfranchised, greater poverty. Of course, families are impacted by police violence and the fear of police. This is just so tragic. And there's things that educators can do to help. We also know that during COVID, when we've had this remote education going on, that students living in poverty and students who come from other cultures or of different racial backgrounds often have less access to technology. And there's more COVID-19 deaths. More people are out, as essential workers, delivering food in grocery stores, as cashiers, and other things that are support services that give them, a greater chance of becoming infected with COVID. And we also know that during this time, it is a time where there's global support for justice. And this is, if there's anything really good about this time, seeing that global support is one of those things that warms our heart. We're so pleased to see the number of people that show up and say, hey, we do care, and we're going to work towards justice. You're here today to learn a little bit about S-CCATE and how that might help as you think about all the things we're going through related to trauma right now and related to thinking about equity and justice. So we wanted to start by showing you a few of our questions. S-CCATE is a simple instrument. It takes 12 to 15 minutes to go ahead and take the S-CCATE. And there's a scale of 1 to 4, from needs improvement to exemplary. We urge schools to aim for exemplary because we don't want to be faced with a situation where the students who are most at risk are the ones who are ignored because we think 3 is just fine. But if we look at these questions, feeling safe, we know is important. We know that protecting themselves in vulnerable situations is important for students. And there are ways to teach that sort of resiliency, that students can show empathy for others, and that awareness of our own bias and prejudice will impact our effectiveness in being mindful teachers, and in being responsive to the needs of all the students in our classes. S-CCATE is also built on the foundation of heart-centered learning. Heart-centered learning is philosophy of the Center for Educational Improvement. Michelle and I and others have been working for about the last 9 or 10 years looking at heart-centered education. And in fact, we've written a couple books about it. We say it starts with the foundation of mindfulness, that conscious awareness, that without that, it's really difficult to show compassion when it's needed. However, when you practice mindfulness, you can help students become more compassionate. And as they practice mindfulness and compassion day in and day out, students gain confidence in their ability to stand up for themselves, to stand up for a peer who may be bullied, for example, and their confidence in just being able to go forward and be successful. With that confidence comes more courage. And courage, is one of these things we don't talk about all that often when we think about education, when we think about academics. But look at what's going on now and the courage it takes to be one of the frontline workers. The courage it takes even to stand up to your peers and say, you know what, I've got to wear a mask. I've got to do my social distancing. Courage is really critical. All of these things can be promoted in a heart-centered community, in a place where we build on the strength and foundation of consciousness and mindfulness in a way so that we think about everyone in our community. So it's a welcoming community, and we build a sense of spirit as we work together. So what did we do? Michelle and I and others held focus groups with principals and other educational leaders over a course of 4 to 5 years. And we took some 80 pages of rubrics and over a long period of time narrowed down these 80 pages to 40 essential questions. And an instrument that can be taken in 12 to 15 minutes. So we went out a couple of years ago and we did a validation study. And we had a sample of over 800 educators across the United States, had very high reliability and validity score. With S-CCATE, you get not only S-CCATE itself, but there is what we call the S-CCATE supplement, which is a test that we recommend you can administer in the middle of the year. So you start out in the fall, and in the middle of the year, you can use the S-CCATE supplement. And then later in the year, go back and measure progress. And there's the phases. So we start with an initial assessment, beginning of the year, to figure out what's going on. And the questions are asked in such a way that we look at the educators' opinions of self, how they think their students are doing, how they think their community is doing, and what about their leaders? How would they rate their leaders in the school? So from the assessment, teachers and others go into a planning phase. They look at results, they think about what they're going to do, and then make decisions about implementation. And they go ahead and they will implement some of the recommendations from S-CCATE. Mid-year, they'll do a second administration, or they'll administer the supplement. Later, there's a progress check. And from that check comes the second phase of implementation. Then re-administration of S-CCATE or the supplement. And that cycle continues so that by the end of the year, you have an end of the year results and you can think about the next year and what needs to happen next. So in New England, we have been using S-CCATE for the last couple of years in a program that we're doing with Yale University and a childhood trauma learning collaborative, where we have some 24 fellows from the 6 New England states who work with us. Between March and November 2019, we had about 1,100 responses. Any time that the schools have at least 7 responses, schools then end up getting basic recommendations and action guides. We really need that 7 in order to have a sample that's valid enough to do something with in terms of the recommendations. So based on the recommendations in New England, they've been implementing strategies for improvement and doing progress monitoring every 2 to 3 months. So here are some other questions. We'll think about conscious awareness of stress and emotion, which is one of the factors, one of the components of S-CCATE. For that, we have questions such as, are students taught about the neuroscience between drug and alcohol abuse? Do students regularly practice mindfulness? Do students practice appropriate risk-taking? And what about my environment? Is it structured to reduce the impacts of childhood stress and trauma? Now, for those of you who are already doing some of these things, one of the good things about S-CCATE is it gives you a way to document your progress and to celebrate your growth.
So now we're going to take you onto the S-CCATE website. When you get this slideshow, this video will be embedded in it, and it's a tutorial of how to use the site on your own, but I'll just take you through some things really quickly. So this is scate.org, where the S-CCATE survey lives, and you can look at it on your own by clicking the Get Started for Free button, where you would get a sample of the first 10 questions. But if you want to return to our next simulation, you'll get access to the whole survey in a demo situation. But on the scate.org website, you can learn more about the purpose of S-CCATE and why you might want to use it. You can also learn more about the validation study, where we found that S-CCATE and the supplement were a reliable and valid tool for assessing school culture. You can also learn more about why you might want to use it as a valuable tool in your district or school. And if you do happen to be in the New England area, please know that the S-CCATE is available to your school for free. And you can learn more about the Childhood Trauma Learning Collaborative, which Chris just mentioned. And you can contact us to get access to the S-CCATE for free for your school. So go to scate.org to learn more, or come to the next simulation for a full demo. So when you have 7 or more of your staff at your school take the S-CCATE, you do get a report that is going to give you a comparison of the 5 factors of S-CCATE, which you can see on the left, to the national sample. And these 5 factors align with the 5 C's that Chris mentioned earlier. So if you do use S-CCATE in your school and you want to join the Childhood Trauma Learning Collaborative, we do trainings throughout the year that help support growth in all 5 of these areas. And the Center for Educational Improvement also has a lot of blogs and other resources, as well as the New England Mental Health Technology Transfer Center. We have a lot of resources to support school growth in all 5 of these areas.
Hi, everyone. So let's just talk about the recommendations for a moment. So the recommendations are just basic things that allow you to really work on certain of the factors. And so if you look right here, this is factor 2, awareness of stress and emotions, conscious awareness. And this is one of the factors that a lot of the schools still need work on. So here's an example that Chris had already talked about, learning to practice mindfulness, yoga, and meditation. And truthfully, now more than ever, staying in the present and having the ability to calm your brain and quiet your thoughts is most important in order to serve your students and yourself well. So recommendations are basic recommendations that come along with taking the S-CCATE and the results. Next. Thank you. And here is a chart of the different costs and the different components that you would get with certain pricing ranges. And as Chris had pointed out, the New England schools right now have really a chance to take this and to take advantage of the recommendations, whereas others outside of New England actually have some type of charge as listed here, from the basic and to the pro and to the pro plus. And with each level comes a higher level of some kind of guidance or recommendations with those packages and training. For instance, with the Pro Plus, you are getting the action guide, which we'll talk about the difference between that and the basic recommendations.
So Michelle, before we go on, we had a talk the other day and you were explaining some of the ways that schools can fund this work. some of the places they can turn to. Could you just go over that again?
Okay, so it's as far as funding, to find funding to actually take advantage of S-CCATE. Yes, so actually, that wasn't me that was talking about the funding with that, but I do know that right now, because SEL is such one of the biggest drivers right now of school systems, that there are monies because they want the data that specifically speaks to the social emotional learning. And the 5 C's are the social emotional learning approach that's totally embedded into this document. So that's one of the ways. And I also know that there can possibly be federal monies as well, title monies that are used, because in the S-CCATE, it also has embedded the stress component for both staff and students, and to really pay attention to that. And our recommendations and action guides speak directly to that, how to take care of yourself, which is part of the federal titles monies, as well as your students and the stress level. Healthy educators are the most productive and effective educators. And we can't take care of our students without taking care of ourselves first. So those are 2 of the ways that you can find monies to fund this for sure. And the cost is really minimal compared to the return. Was there anything else that you could add, Chris?
I think that was the basics. Thank you.
Okay, great. All right, so the next one, the action guides. We are so proud of this. It's taken such a team of experts to put this together. Really a meeting of the minds of all different avenues, from neuroscience to trauma experts to mindfulness experts. And, you know, really, these action guides are like a blueprint which you facilitate and build capacity within. Our S-CCATE isn't about us coming in and telling you what to do. It is about giving you the information to build the capacity for change, school culture change, to really build towards that compassionate, heart-filled, heart-centered learning environment that will most meet the needs, both social, emotional, and academic, of students and staff and whole community. And these action guides really are linked and embedded in and connected to professional development, the school policies. So you're really examining those closely to make sure they match with these individual factors that you are working on, as well as the curriculum. When Chris talked about the 5 C's, now more than ever, we need confidence and courage, but you cannot have that in order to build community until you have that conscious awareness. How do we get there? How do we meet the needs of others who are suffering and in pain, so that they can even access the prefrontal cortex of the brain so that they can learn? And what I just have to say this about the action guides too, is that, you know, when we were doing the beginnings of these focus groups to create the S-CCATE, one of the things that we could not have predicted is COVID and it hitting, or the racial inequity and destruction that is happening right now throughout our country. What we did know was that trauma and stress was paramount, and we needed the solution, a natural a solution where everybody could take hold to try to mitigate the trauma and suffering that was happening. And that was 5 years plus ago. And look where we are today. It's never become more relevant when I think of the different categories that we developed back then, from compassion for self and others, to understanding equity, courage and resilience, and then that conscious awareness of emotion and stress. I mean, we really are evolving here, and we were at the front of it. So with these action guides, it would give you all the tools to really create that incredible, compassionate school community that is absolutely needed today. So that's the difference. And then our companion books. This is just one more supplement. We have mindfulness practice, which sets the foundational practice of the 5 C's, the social emotional approach, by really helping you understand what a heightened consciousness is. Like Chris said, it's just not the practice of mindfulness and understanding breath and how it can calm your physiological response. It is about understanding how important it is to be fully aware and fully present with all your senses while you're teaching, you're interacting, whether remote or in person. And then Mindful School Communities just picks up and goes through the other 5 C's. And it is a curriculum that can be used remotely, virtually, hybrid, or in person. It gives you all of the exercises and resources that you need to build a mindful, compassionate school community. And then the visioning tool of Chris's book, the 3rd book, this is a complete package of a build and blend model of heart-centered learning, where every child can succeed and thrive, as well as staff in the larger community.
Michelle, if I could just add there too with the visioning, if you think about it, many school districts right now are trying to plan for the future. You know, we've been doing that for the last few months. Well, planning is one thing, visioning is another. If in fact you've had a vision before that children would be treated better, that they would be more resilient, that they would experience less trauma, if you felt like kind of the lone wolf with that vision, our approach to visioning says, hey, it needs to be collective. We need a group. It needs to be iterative. So you take some time to think about, to reflect, and to come together and vision. And that time factor and that coming together over and over again to reflect and to decide on what you want to do together is just so critical, and never more critical than right now. And we like to say we like to help you vision not only for the next 6 to 8 months, but also for 8 months from now, a year from now. And what do we want to take? What is good that's happening right now that we want to take forward? So again, our tools work together to give you a package that's comprehensive and one that where you can look at our practices and adapt them across grade levels, across circumstances.
And Chris, can I just add the last thing, which is what you just spoke of, was the connectedness, right? That shared responsibility, now than more than ever, it's most important. And when you were talking about shared responsibility and collective approach, that's what it is connecting and getting through this together and envisioning something better.
So we have time now for questions. We stayed pretty true to the half hour. So you can type questions in the chat box, or you can you raise your hand too? Do we have the ability to see hand raises? I think we might. Well, it may take time for you to figure out what your questions are. You can certainly go to our website. And Danny, do you want to show the next slide? So there's ways to contact all of us, any of us. Okay, we're happy to take your questions. Here's the website address as well. And I just want to point out that we are doing work right now in New England as part of the work with SAMHSA and the Mental Health Technology Transfer Center Network. The focus is on children with the most serious behavior and mental challenges. And we're trying to do what we can to make school environments better environments for everyone. So really to support and uplift schools. We have a Compassion Action newsletter that comes out every other month. And in between that, we typically have products that will help improve compassion in schools and address mental health challenges. And the Compassion Action is something that's available at no charge, and we do distribute it nationally. So right now we have over 10,000 subscribers. So We hope you'll take a look at it and you'll find it to be useful. And Dana, is there anything else we need to say?
Yes, if you would like to join us for the next simulation on September 8th at 4 p.m., we will actually give you a chance to take the tool and discuss any learnings or wonderings about it. And then we have 2 more sessions where you'll get to learn how S-CCATE can help strengthen your school's response to trauma and COVID-19, and also talk about how S-CCATE can support core learning teams addressing trauma. That's it.
So thank you for joining us today. Stay safe, be well.
Thank you. Have a great night.